attend our 9th Business Matters Chat. As always, we welcome your participation with questions following our speaker's remarks today. If you have questions, please put them in the chat box, and Anna's monitoring that, and we will do our best to get to as many of them as we can and as time allows. And I'm really pleased today we have to have with us Lisa Just, Bob Miller, and Dr. Raj Thoda. Lisa Just is the president of Advocate Aurora Health, South Wisconsin Patient Service Area, including serving as president of Aurora Medical Center, Mount Pleasant, and oversight of Aurora Medical Center, Burlington, Aurora Lakeland Medical Center, Aurora Medical Center, Kenosha, and Advocate Aurora Medical Group clinics in Racine, Kenosha, and Walworth counties. If you know Lisa, you know she's very active in the community. She serves on the University of Wisconsin Parkside Foundation Board, the Racine County Economic Development Corporation Board, and the Kenosha Area Business Alliance Board. Recently, she served as the chairperson for the United Way's 2020 campaign. Lisa earned her master's degree in Health Services Administration from Cardinal Stritch University and a bachelor's degree in physical therapy from the University of Wisconsin-La Crosse. I'm also happy to say today we have with us Bob Miller, who is the president of Aurora Medical Center, Burlington. Bob grew up in the St. Louis area and began his professional career as County Health Department Inspector in Peoria, Illinois. This experience affirmed to him that he enjoyed applied science, but felt that working in the healthcare setting was probably a better fit for him. Bob got his BS Environmental Health from Illinois State University in Normal, Illinois, and his MBA with a concentration in Health Service Management from Webster University in St. Louis, Missouri. He is an American College of Healthcare Executives Fellow and a GE Healthcare Management Academy Fellow. And certainly, last but not least, I am pleased to have with us Dr. Raj Thoda. Dr. Thoda, during his 31-year tenure with Aurora Health Center, he served as a CMO for Burlington and Walworth portion of South Central Wisconsin and Northwest Chicagoland patient service area. During his tenure, he has made significant contributions, including facilitating and opening an ongoing success of Aurora Health Center's Southern Lakes, consolidation of the medical staffs of Aurora Memorial Hospital of Burlington and Aurora Lakeland Medical Center. He also started a rural family medicine residency program at Aurora Lakeland Medical Center and significant improvements in patient experience and clinical quality safety. Please join me in welcoming our three distinguished guests today. With that, Lisa, I'll turn it over to you.
All right, Matt, thank you. And Anna, thank you so much. On behalf of RAMAC, Raj and Bob and I are thrilled to be a part of today's business chat. So our intent today is to simply give a brief overview of Advocate Aurora Health and our services in Racine County. And then Bob Miller will give an overview of our look back as well as a look forward of our COVID-19 journey. And Dr. Raj Thoda will provide us with some information up to date regarding the COVID-19 vaccine. And then of course, we're most looking forward to answering your questions as best as possible. So if you want to start the slides here and start sharing, Marley. And we can move right to the next slide. So just that overview, and next slide, Marley. Just that overview of Advocate Aurora. Our purpose is that we help people live well. We're guided by our values of excellence, compassion, and respect. We focus on our patients, our people, and our communities, and we're committed to diversity, equity, and inclusion. Next slide. So Transformation 2025 is Advocate Aurora's 5-year strategic plan to achieve destination health. And we do that by focusing on 3 core areas. The first one is transforming our core, which is really looking at those operational functions of safety, health outcomes, growth, and financial health. The second is to embrace a consumer-first model. And you'll see examples of that as Bob Miller provides you with how we responded to the COVID-19 pandemic. And third is our whole person health focus. And you may have seen in recent news releases that we have an Advocate Aurora Enterprises, a new subsidiary, who recently acquired Senior Helpers, who is a leader in home care and senior wellness, as well as our investment in Food Smart, which is a national telenutrition and food care leader. So that area of really looking at new models of care and consumer health businesses. Next slide. Believe it or not, it has been 3 years since Aurora Healthcare merged with Advocate. So Wisconsin merged with the Illinois healthcare providers, and we now represent as a merged organization 26 hospitals, over 500 sites of care, over 75,000 team members or employees. And we're in the top 12 of the not-for-profit private health systems. So we're in good company with Ascension, who is still in that #1 spot for that listing. Next slide. So Advocate Aurora Health structures its geography into 7 different patient service areas across Wisconsin and Illinois in order to focus our leadership and operations in the same way that healthcare is predominantly delivered, that is locally. So you'll see right in the middle of this map is our geography that we're representing today, the South Wisconsin Patient Service Area that you heard Matt reply to in my bio. And we run right along that Wisconsin-Illinois border. So next slide will give you a little bit more of a close-up of that geography. It includes the counties of Racine, Kenosha County, and Walworth County. And so in the South Wisconsin PSA, we have 3 hospitals, soon to be 4, 3 surgery centers, over 53 outpatient locations, 15 pharmacies, and we employ over 5,000 team members. So next slide, let's take a look at Racine County specifically here. We have our flagship clinic and surgery center, which is the one on east of the interstate, which is at 8400 Washington Avenue, and that's on that top left photo. And of course, we need to have a flagship west of the I as well, and that is our Southern Lake Surgery Center and Medical Office building, which is off the Highway 11 bypass. And that is the bottom right photo. We also have depicted here our two newest clinics, the one that just opened last March on Spring Street, and the one that opened, so it was a year ago, March, and the one on the right side top is our Green Bay Road site, which is in the old Pier 1 building, which just opened February of this year. And then the other photo in that bottom left is our Aurora Medical Center, Burlington. So not pictured are locations at Razor Sharp, Warwick Way, and in Caledonia, Union Grove, Burlington, and Waterford. So Advocate Aurora Health in Racine County has over 1,400 team members. So next slide. As I alluded that we have soon to be that 4th hospital, our current construction project is the 198,000 square foot Aurora Medical Center, Mount Pleasant, located on the northeast corner of Highway 20 in the interstate, and we are on target to be opening the first quarter of 2022. So we've had 300 construction workers on this site, made up of a predominantly local workforce. All major contractors have been from Wisconsin, Illinois, or Minnesota, and a number of our trade partners are based right here in Racine or Kenosha counties. And with our focus on diversity and inclusion, to date, I'm proud to say that we're at 22% of our target of 25 for providing diverse craft hours and have reached our 25% goal for diverse spend. Before the pandemic, our trade partners of Mortensen and Westfall partnered with the Building to Learn program from Racine Horlick High School. This program has high school curricula that is dedicated to teaching students about the building trades with the intent to create a dedicated pipeline of talent for these labor trades. There was an open house in February of 2020 to showcase the students' work, and our Mount Pleasant construction project was fortunate enough to hire 3 apprentices through that specific endeavor. In order to support a pipeline for the Mount Pleasant Hospital employment of 300 new jobs coming to the area, we've been working on internship opportunities for the Racine High School students for the 21-22 school year, And then those will be based first at the Kenosha Hospital, as well as our Racine clinics, and then move to the Mount Pleasant Hospital as soon as the Mount Pleasant Hospital opens. We've additionally have partnered with the Academies of Racine to provide panelists for career talks, and we'll be piloting a virtual job shadows program for the Academy's health science students this month and next. And that's going to entail a virtual job shadow in both our lab and our imaging departments with a live Q&A hosted by our own Advocate Aurora team members. One last note about our hospital construction that I just have to personally share because I find it fascinating and I'm not sure why, but maybe you as well. We've had almost 30% of the construction of this hospital prefabricated. So it actually was built in a leased warehouse in the Renaissance Park. So for example, we had 66 bathrooms that were entirely put together, including with fixtures, tile, even soap and paper towel dispensers. It was then picked up, those 66 units picked up, put on a flatbed bed truck and trucked over to the hospital. And then with a crane just moved right into the hospital for installation. So I just found the whole idea of prefabrication with a new building like this very cutting edge, and was it created a much quicker process for us and a much safer process as well. So next slide is just some renderings of what the hospital will look like in the inside once it's finished. So you see a patient room will have 60 rooms, 12 ICU, intensive care, and 48 med surge. You see the emergency room there, what that will look like, and then our sports health and rehab department, as well as what the courtyard would look like. You're actually looking out towards the interstate right now from that view, and then what our lobby would look like as well. And then the next slide is also part of the campus, is a 98,000 square foot medical office building. You can see a number of our specialty physicians that is listed on the slide will be moving from the 8400 Washington Avenue site to the Mount Pleasant Hospital campus, to this new medical office building, in order to have easy access to our inpatients. So patients that are affected by those moves will have full communication of who will be affected by this move as we get closer to the opening. No current Aurora facilities are closing as a result of this construction project, and the space at the 8400 site will be backfilled. So now I'd like to turn it over to Bob Miller to provide some information on Advocate Aurora's response to the pandemic.
All right, thank you very much, Lisa. Thank you again for the opportunity to be with you today to talk a little bit about Advocate Aurora Health and what we're doing in our area. This slide really is sort of a snapshot of what COVID has meant to us over the past year. So this was actually just about 1 year into the COVID pandemic, and you'll see several statistics displayed on this screen. I'm not going to read them to you, but I will highlight just a few of the elements of this slide. 21,000 patients discharged. That was as of about probably a month ago from Advocate Aurora facilities. Gives you sort of the scope and magnitude of what we've been dealing with as a system. 1 million in COVID testing that has been done over the course of that 1 year. And then PPE, you see there astronomical number of over 300 million pieces of PPE that have been sourced and distributed throughout our Advocate Aurora system. This is just a phenomenal feat, as everyone was dealing with shortages with PPE, yet we were very stable for the most part throughout the height of the COVID situation. And then lastly, just mentioning the vaccine number. You see the number there at 258,000 vaccines given. And I will tell you that number has more than doubled since this slide was created. We are now today at 544,000 vaccines given. Next slide, please. From the beginning of the pandemic, everyone was understandably very concerned about safety, their personal safety as patients and as visitors and others that would come into our facilities. And one of the things that we started on early was the Safe Care Promise. Safe Care Promise is really around keeping patients safe, keeping our team members safe, and really creating an environment where people who needed to access care could get it or felt comfortable in getting it. So we needed to really rebuild consumer confidence and encouraging patients and visitors to come in and get the care they needed, because I think we know by now that delays in patient care, particularly during COVID, have created situations where patients of exacerbated pre-existing conditions have made their situation much worse, and we certainly don't want that to continue. So a lot of work done to try to promote this. First, you see virtual check-in, and that's a big part of what we do here in terms of the digital devices and opportunities we have for people to access care. You heard Lisa mention on the T25 or Transformation 2025 slide about what we're doing to keep the consumer center and first and foremost. Well, virtual healthcare has taken a quantum leap in the past year as we've dealt with the COVID crisis. So it's been incredible that we've done over a million virtual visits in that time. So that's just one element of this. Online options are also available, as well as self-rooming. If you come into our facilities, we have an app, a phone app called Live Well, that has been accessed and utilized by close to 1 million individuals, downloaded and used. Screening, every patient that comes through our doors is screened. Masking, everyone has to wear a mask when they enter. And social distancing, we've rearranged our waiting areas to facilitate distancing between patients to create a safer space. And then, of course, enhanced cleaning to ensure that we're disinfecting areas that are critically important in high-touch areas. Next slide. Now, this slide is about our vaccine program, as we now are celebrating over 30,000 total vaccines given in our South Wisconsin PSA between 4 locations in Burlington, Lakeland, Kenosha, and Pleasant Prairie. So we're very excited about this. And we started our program, as I said, more than 4 months ago. And we started with, of course, our healthcare workers first, and then our non-employed or aligned healthcare workers in our communities, educators, and then transitioned to our patients who were 65 and older, prioritizing them by their vulnerability. And then since that time have moved on to patients 16 and above, and the 16 and 17-year-olds receive the Pfizer vaccine. That's the only current supplier right now that goes to the age of 16. So 16 and 17-year-olds Pfizer, the others Moderna, and it was Jansen and Jansen. J&J, as you know, is being paused right now as they evaluate that situation with blood clotting that I'm sure Raj will tell you more about. Wisconsin is now, the state of Wisconsin has now opened up the vaccination program to everyone, public included, 16 and older. We are now doing as well with the public. So not just our patients, but the public in general. 7 days per week. You can access scheduling through our Live Well app, our internet site at aah.org, or a hotline number that is also on the website of aah.org. So with that, I'd like to pass it off to Dr. Raj Thoda to tell you just a little bit more about our vaccines.
Thank you, Bob. Good afternoon, everyone. So I'd like to go over the vaccines, COVID-19 vaccines. The 3 vaccines that have been approved both by the FDA and the CDC for emergency use authorization. The first one was Pfizer, as Bob indicated. This is for people 16 and older. The good news is they are in the process of applying for emergency use authorization for 12 and older. So it has good success and so on. You're going to be hearing about that very soon. So that gives a chance for our adolescents. So 2 shots, minimum 3 weeks apart. And when do you receive immunity? It's 2 weeks after your second shot. Moderna was the second one that got approved. And this is definitely for people 18 and older. Again, 2 shots given, minimum 4 weeks apart. And you get immunity 2 weeks after that. The last one is what Bob alluded to, did get its approval. The Johnson & Johnson, or the other way, use is Jameson Vaccine. It is for 18 and older. It was 1 shot only, and it is, you get immunity 2 weeks after the shot. And again, as Bob alluded, following the guidance of the FDA and the CDC, there is pausing of the administration of the Jansen vaccine. The reason being is the decision was made when 6 reported US cases out of 6.8 million administered doses. That's 1 case in every over 1 million doses. We found a rare and severe type of blood clot. Currently, these adverse effects seems to be extremely rare in a select group of patients, and the CDC and the FDA recommended a temporary suspension of the Jansen vaccines until they review. So Dr. Fauci has been mentioning if we will need this vaccine to get to our desired effect, so they'll be coming back into play. I'm constantly asked, what is the best COVID-19 vaccine? And my recommendation is the first one that is available to you, that is the best one. Both Moderna and Pfizer are currently authorized and recommended COVID-19 vaccine. They are safe, they're effective, and they reduce your risk of severe illness. Marley, next slide, please. So let's talk about the vaccines themselves. All 3 of the COVID-19 vaccines provide immunity against COVID virus, the coronavirus, and its mutations. I want to give you a little background on how these vaccines came into play. Background: flu vaccine, we use small amount of the flu virus itself and to build immunity against the flu. How do these vaccines work? The Moderna and Pfizer are called mRNA vaccines. And what they stand for, they use part of the coronavirus in the vaccine to build the immunity against the coronavirus. So we're not giving live viruses to get the immunity. The Jansen vaccine is a little bit different. What we do is that we use a virus, usually the common cold virus, and inject that with parts of the coronavirus to produce the immunity against it. Both of these vaccine methods have been around for a long time, at least over 10 years, and they've been used for vaccination against some of the deadly diseases such as Ebola, SARS, and MERS. So this is not anything new. This method has been along for a long time, but in the US, this is the first we're hearing this type. Next slide. People ask me, when is it medically safe to, take off my mask, to go back to living normally? And the answer is when we get herd immunity. So what is herd immunity? Basically put, in order for COVID to continue infecting and continue to mutate, it will need non-immune hosts. People that don't have immunity are not vaccinated. That's the simple answer. And so there are some pictures here, how it looks when it's 5%, 30%. The goal is 75% of us get vaccinated in the US or greater. We will reach herd immunity, and COVID would be a thing of the past, but we need to get that. And so the slide goes into herd immunity, how it works in several ways. So next slide. People ask me about side effects. The most common, and Jansen vaccine is similar, is the fatigue, headache, muscle and joint ache. Less common is the fever and the vomiting. Those black lines that you see there are placebo. So that is, people can still get these side effects even if the vaccine is not present. Next slide, please. So who are the people that should not get the COVID vaccine? So what I want to do is, before I go through the slide, I want to define what a severe allergic reaction. For different people, it means different things, but from a medical standpoint, a severe allergic reaction is when you stop breathing, throat is swollen, or you need to go to the emergency room to get the proper treatment to get out of the allergic reaction. So that's the medical definition here for a severe allergic reaction. So who are the people that should not get the COVID-19 vaccinations? These are people that are allergic to polyethylene glycol. Some of you might have heard it. It is available in a common over-the-counter product called Miralax. We use that in constipation for bowel movements and so on, if you're allergic to that. And also a chemical called polysorbate, very, very common chemical that's in food products and also for skin products and so on. If you have a severe allergic reaction to these two things, you should, are contraindicated from getting the vaccine. Also, if there's any questions, I will always default, please check with your physician. They can walk you through that. So prior to the second injection, who are the people that should not get the second shot? Because both Moderna and Pfizer are. These are people that had a severe allergic reaction to the first one. This is anaphylaxis. This is what I'm talking about. Stop breathing, blood pressure drop, throat swollen, and you needed to go to the emergency room to get you back up there. Things that you should be cautious about, people always ask me that, if you had previous reactions to injectable medications, then it's a good idea to contact and touch base with your physician, because these are people that can still get the vaccine, but we usually administer some antihistamine like Benadryl or Tylenol before you get the vaccine. So the risks and the benefits your physician can go through. All right, next slide, please. So no contraindication because of the technology, how these vaccines are developed is, if you had a previous allergic reaction to a certain food like peanuts or tree nuts or oral medications like penicillin and so on, this is not a contraindication to get this vaccine. Or previously, if you had a neurological condition that you suffered after a previous vaccine called Guillain-Barré, you still are able to get this vaccine. Immunodeficient patients, because we are not administering live virus to you, are safe. Again, risks versus benefits, and the benefits outweigh the risks here. Including pregnant patients. Now that these vaccines have been available, we do have studies, and there's larger studies in the process. It's safe to get it, but definitely the caveat is please check with your OBGYN. And again, we look at the risk versus the benefit. And if you had a delayed skin reactions, like it's a little bit swollen, a little itchy, again, you are safe to take the second dose or even the first dose. Next slide, Martha. So, when can we get out of all of this? Live normal lives, go to baseball games in masses, concert is, our shot at a brighter tomorrow is taking the first step to help beat the pandemic. That is getting the vaccine. Thank you. And I know there's some questions.
Great, thank you so much. Marley, we can just stop sharing so we can see each other a little better. Thank you. So my first question, there's a few in the queue that I'll get to, but my first question is, do you believe, I've heard, will we have to do boosters for the vaccine in the future? Is that, I've kind of seen, 12 months down the road, that's a possibility.
So yeah, again, just to be clear, a lot depends on, there are studies that are being done on whether we need boosters or not. And also it depends when we reach herd immunity. Truly, if the virus is slowing down or stopping and stop mutating, truly it would be a thing of the past. So the answer to that question is there is more to come at this point. Research, as vaccinations are happening, as we are getting further along, we are able to check on the people that receive those vaccines first to how long they're continuing to have immunity. What we found out also is people that get the infection, they say, I don't need a vaccine because I had the infection. We're seeing that is not lasting as long as when we vaccinate people.
Great tips. I appreciate that. Staying on the COVID specific discussion, do you have whoever wants to take the answer? Sorry, my phone was ringing. Sorry. Do you have an insight on the recent increase in COVID cases, whether that's just Racine County or South Wisconsin?
We see nationally, and some of you might be in national news, you're hearing about Michigan having that. Truly, this is, some of my patients says, this is just like the flu back, we're going to get over it. No, this is truly is not like the flu. All viruses mutate, but this coronavirus is mutating at such a fast rate. So the reason for the increase we are finding out is the virus is mutating, and we still have a lot of hosts, a lot of people that do not have the immunity that are getting these infections. So, and the other thing we're noticing, and this is personal comment, is people are tired of this, so the safe distancing, are we still as, careful as doing the masking, in public places, hand hygiene, social distancing. I think I'm seeing a little bit of a COVID fatigue, as I call it. People are done with, so we're letting our guard down, and we're seeing that. Lisa and Bob, anything you want to?
No, I think you covered it well, Raj.
Yep, definitely COVID fatigue it's a real thing. So I think so is Zoom fatigue. So thank you all for being patient with us. So a couple questions came in more specific about hiring and your new facilities. So what do you think, Lisa, maybe this is for you. What do you think about the challenges of hiring nurses or other positions for the new facilities in, now or even just in the coming years?
Yeah, so if anything is the challenge of opening this new facility, it's being sure that we have enough staff that are to do this. As I mentioned earlier, we're projecting 300 new jobs. It's 200 clinical jobs and 100 support jobs. And we know that we're going to have some individuals transferring from some of our other Aurora sites who, live in the community and want to be a part of a new hospital opening. But I don't think my challenges are probably any more, critical than all of your challenges here, no matter what industry that we're in, with the low unemployment we have and your struggles to find skilled individuals and individuals who want to come to work. Every time I'm in a business meeting, that's, part of the discussion there. So, we've been, building for this point in time for quite some time, which is why, I was glad to be able to share what we're doing to increase the pipeline, and knowing that, we try to be as much of a top employer as possible as Advocate Aurora in the state of Wisconsin, so that we can attract and retain our employee base as well. But we are, and we've already, we started 6 months ago on this on this employment and workforce development journey for our planned opening in February of 2022.
So I have a question for one of the three of you also to weigh in, because, in this past year, many businesses have suffered. Schools have been closed. They're now getting reopened. Kids are getting back in, which is much needed. But when you take, for example, and I'll use our Racine Zoo as an example. When you have a facility like that, where people can be outdoors, gather, walk around, do you see that as a health risk in really not allowing places like this to reopen? Do you look at those? Do you view them as your medical profession or medical opinion that these are spreader events, if you will, with people walking around?
And I can start, Matt, thank you for that question. As long as guidelines are being followed, meaning avoiding, the social distancing is going to be important. There's enough hand sanitizers that people can do, and, and then they'll continue to wear masks and so on. Those are going to be the critical things. And
Right.
as you can see in baseball and other sporting events, we're slowly introducing, more and more people to this. And definitely, again, from a medical, it's not only the vaccination, I also see the psychological effects of being isolated. That's not good either. So, the answer to your question is, it depends on the situation, but if the entity, the business and so on, takes the precautions, and that's what Aurora has done, the Safe Care Promise, yes, we can slowly open up to more and more things, and we need to do that.
Yeah, we still obviously want to be partnering with our public health officers, with Dottie K. Bowersox and Margaret Gessner, to do what's best from a public health perspective. But I tell you, Matt, I still have my tickets that I bought 2 years ago for animal crackers last year, and they told me it's going to be good for this year. So I'm hopeful that we're going to be able to attend those concerts. So.
Well, I asked that question really in particular because I've noticed our Milwaukee Zoo has reopened to about 75%, Green Bay, Madison, but yet here in Racine, we're really locked down to 500 people during the day and 200 people at night. So trying to understand why we can't reopen our zoo to some capacity where animal crackers can take place and, other events. Again, we're sitting on 28 acres. So that in outdoor environments, and Beth does a great job at the zoo. People mask up, they hand sanitize, they keep their distance, but trying to figure out why we can't get to that point. So.
Yeah, and I just want to chime in and second that, because if you compare the two, Henry Violet Zoo in Madison is 28 acres. They were 28 acres in Racine. They're now at 50% capacity and no masks outside whatsoever. So we're trying to understand. People keep telling us to follow the science, but it almost seems to me here personally in Racine that there's no science to this. And to have 500 people during the day, but we're restricted to 200 at night, to me that it just doesn't. There's no formula behind it. Right now Racine Zoo is the most restricted zoo in the country. Okay, so they have an 8% capacity during the day and 3% at night. And I've asked this question. Numerous people are asking this question, but we're not getting an answer or some kind of a formula or scientific answer behind it. So
That's
from your
the
medical
gist of the
professional
question.
opinion, right?
Thanks for bringing that up. Thanks, Tim, for weighing in on that. Anna, you have more questions?
Yes, there's kind of real specific to where is or do you have an occupational health facility?
Yeah, so right now I mentioned our new Spring Street clinic, and our occupational health department is being run currently out of the Spring Street. So that's Spring Street and Sunny Slope. I'm not saying that after, I said that 8400 will be backfilled once that new medical office building. So I'm not sure if it'll come to 8400 after that, but right now it's on Spring Street and has great access for employees going there.
Great. And then do you have any requirements for your employees about vaccinations?
So it is not mandatory, but it's highly encouraged because our employees are patient facing and so on. We're highly encouraging them the benefits and walking through if there's any hesitancies in walking through that. But it is not mandatory like the flu virus, flu vaccine.
Sure. Okay, I'm just kind of
about hiring new doctors. Will Aurora be hiring new doctors to fill these buildings?
Oh yeah, there.
So yes, we are. And yes, we are in primary care doctors, our hospitalists, and emergency room physicians are our gatekeepers and to our community. I should say they were welcoming. So these are already in place. We're hiring those physicians. We do have a lot of expertise in our specialties that are currently residing in Kenosha, and we are going to make sure that is also available for our Racine community. So some of the doctors in pulmonology, gastroenterology, cardiology, that expertise that we currently have will also be providing services there. But we're definitely, and I'm involved in this, can tell you we're hiring new physicians to provide services.
You had mentioned, Lisa, that you work with high schools and some apprenticeships. Do you work with any of the colleges in the area?
Yeah, so we have partnerships with UW Parkside, with Gateway, with Carthage College on a considerable basis, not only for being able to have their students train at our sites, but to be able to have conversations about how we can help their students on campus as well, and be able to get, so we'll have individuals that are clinical nurse specialists in the hospital, and they're also then they help teach at Parkside or Gateway, so that we've got some shared individuals that way too, so that there's collaboration on curriculum being presented. We would love to be sure that the individuals being trained are trained as best as possible, coming out and ready to take their first job, whether that's at Advocate Aurora or another healthcare system. So we're happy to be a part of that.
Great. I had noticed we have a couple, somebody from Herzing University and that sort of thing. So I wanted to make sure I asked that question. That is it. That's in the queue, and we're perfect, right on time. We try to keep it at about 45 minutes so people can get back to their day. So Matt, anything in closing?
If there's no more questions, and I just would like to thank our distinguished guests for being with us today. We appreciate your time, Lisa Just, Bob Miller, and Dr. Thoda. We appreciate everybody submitting their questions, and just let you know that our last Business Matters chat for this season, if you will, because we'll be taking a few months off, will be Wednesday, May 19th. And our guest speaker will be the new executive director from Racine Public Library, Angela Zimmerman. So with that, again, thank you to everybody and have a great rest of your day.
Thank you, everybody. Bye now.
Thank you. Thank you for participating.